You're welcome back. This is Newsfile. It's the most authoritative news analysis platform. And here on Newsfile, as always, we put Ghana first. Okay. The gentleman I'm about to introduce, I asked my production to look for a blue kiosk and put it behind his monitor for me. And they haven't done that yet. I don't know why. He's told the whole world that he lives in a blue kiosk. We have no idea where that blue kiosk is located, except that we know that he lives in the UK. Good morning, and thank you so very much, Kwame Sapong-Asiedu, for making the time to join us on Newsfile this morning.
Good morning, Samson, and thank you for having me.
Thank you very much. Joining Dr. Kwame Sapong-Asiedu, who is pharmacist and fellow Ghana Center for Democratic Development, CDD, is Dr. Anthony Nsiah-Sarri, Presidential Advisor on Health, and Senor Kwesi Hosi, CEO, Ghana Chamber of Bulk Oil Distributors. Gentlemen on Zoom, thank you so very much for making the time to join us.
Thank you.
Great. So first things first, let's begin with the statement that was issued and signed by Dr. Patrick Kuma Abuaje, Director General of the Ghana Health Service. Dr. Nsiah-Sarri, can you tell us what prompted the issuance of this statement? And the statement clearly tells us that things have changed globally. Several countries are experiencing their fourth wave. A number of travelers from these countries come to Ghana, and this is expected to increase during the festive season. So we are expecting many travelers to come into the country for Christmas. The current surge in COVID-19 cases is being reflected at the Kotoka International Airport. So that's what we're being told, that the surge, the point that it is reflected is at our point of entry, Kotoka International Airport. The statement says that in November 2020, 168 cases were detected compared to 241 cases in November 2021, an increase of over 40%. And it says we have since been recording an average of 20 positive cases a day at the Kotoka International Airport. Tell us about this statement.
Thank you very much, Samson, and good morning to all your cherished viewers and listeners. And also good morning to my fellow participants and panelists. It's true. We know something, we've been here before. Last year, around this time, we were having seemingly very low figures, and everybody thought everything is gone. This year round, we've gone through two waves. One in the early part of the year, January, February, March, and then we have a second wave also in August, September to October. So we don't want to we've learned lessons from whatever happened last year. And as the statement states, we don't have a surge in the country now. Maybe something I have to correct that. What we are having is that we have very low activity of disease in the country, and we are not recording so many people, an average of about 32 positive cases a day. And as the statement rightly said, about 60% of these positive cases, that are the cases that we record at the airport. We add the arriving passengers report to whatever cases that we have in the country. And that's the reason why we are a bit concerned, and we want to prepare ourselves very well for the Christmas festivities. A lot of people are coming all over the country from the diaspora, our own compatriots who are outside. And we've also realized the global surge that some countries are having now. And then with the new variant, which is the Omicron, which also is also ravaging in most parts of the world. So the Ministry of Health, Ghana Health Service, and those of us who are at the forefront of the task force to fight against this pandemic are aware, and we are preparing ourselves towards that. That's the reason why Ghana Health Service was asked to release the press release that they did on the 9th of December 2021.
Right. So clearly the Omicron, which is said to be the more transmissible, has been detected at our airport as well. We are told that of the 34 cases detected, 75% of them were unvaccinated. Over the last 2 weeks, cases from airport account for 60% of the total cases recorded in the country, as you said a while ago. Now,
yes, Samson, that's exactly what is happening.
So what is the intention and how effective will the measures that you are taking as far as regards travelers who are coming into the country and people going out of the country is concerned?
Yeah, Samson, if you notice, we are one of the few countries where we have put a lot of measures in place. Our measures are very unique. One, anybody coming into this country have a 72-hour negative PCR test. So if you don't have a 72-hour negative PCR test, or if you are positive, you will not be allowed even onto the flight. And two, all passengers who arrive in this country are subjected to an immunofluorescent antigen testing at the airport, which we give the results out, and those who are found positive are then mandatory isolated for 7 days. So if you look at this, we have two ways of sieving. At least we are limiting the importation of the virus into the country. I will not sit here and say that we are eliminating it. We are limiting it. So these are the two ways that we are limiting it. We are now adding a third dimension to it, and that is we are now asking that anybody who is coming into this country should be fully vaccinated, so that if you are fully vaccinated, you know what the vaccines do. The vaccines first, even if you have the virus, you will not be so sick to require maybe admission into our few intensive care beds that we have in the country. And also most of the people who, even in country, the people who have had vaccines, who are vaccinated, and those who are not vaccinated, for the past few months when the study was done at our East Infectious Disease Center, we realized about 98% of those who were admitted there are unvaccinated. And those who died, out of a number, only about 2-3% of them are people who have had some vaccination, but they all have some underlying, very severe underlying illnesses.
Okay.
So the reason we are adding the vaccination is that we want to, because we don't have a lot of people in the country who have already been vaccinated. And two, we are taking advantage of the number of vaccines which have come into the country. Now we have a lot of vaccines in the country to also encourage our citizens to also be vaccinated, because we have also added, when you want to travel outside the country, you should also have your full vaccination.
All right, Doc.
So we are using this like using a stone to kill a bird. So we are trying to make sure that we boost and then we give motivation and encourage people who are in country to be vaccinated. We are also trying to make sure that those who are coming are at least also vaccinated, so that you don't come to the country and also pick any variant from Ghana.
It's good you mention this because one of my questions was to ask why there doesn't seem to be the general populace and their compliance or non-compliance with COVID protocols. There doesn't seem to be an address or a focus on that, but only for travelers as far as the statement is concerned. But we'll return to that and ask to know what stringent measures are going to be put in place, because you acknowledge that people are traveling, they are coming in, and the risk is there. But among ourselves here in Ghana, already there are mega programs that are being advertised and people are supposed to attend them. Why should we feel safe? We'll return to that. Yes. So, Dr. Isedi-Sapong, what do you say about this particular release and the manner in which it is targeted at travelers, how effective is it going to be?
Samson, and good morning to my fellow panelists. I look at this from the point of view that I am predominantly a traveler. I'm a nomad by practice because of the way my work goes. So I have to subject myself to a number of these tests, vaccinations, and all that. So when I look at the statement, I look at it from the point of view that in anything you do, there's a balance between what is legal from a human rights standpoint and whether you are infringing on people's rights to choose and their rights to make informed judgments about their personal health care. Then there is the laws around public health, which enjoin those who manage our public health ecosystem to protect the health and well-being of the citizenry. So that's their mandate. So they have come out with a statement because they are managing public health. And I hear a lot of rampants going on around how it infringes on the rights of people. Looking at the statement, I ask, where does the individual's right to choose end? And where does the public health mandate of the managers of our public health system begin? And which one, in a pandemic, should supersede the other? If you ask me, and on the basis of all the laws that were passed in our parliaments, not just in Ghana, globally, you would realize that during this pandemic, public health priorities have been allowed to prevail. In fact, I've just come from a forum where one of the things we were discussing was how, as a result of this pandemic, democracy had been constrained, because all these things constrain aspects of our democratic credentials.
That's right.
So I look at it that broadly, the inconvenience, the legal aspects, the public health aspects, and I say, great, you want to sort this thing out. You want to minimize the inflow because last Christmas we knew what happened. Even though we were told then, because of other things, that mass gatherings didn't do this and all that, and the whole thing was flaxed, we all know that by November of last year, some of us had started raising the red flags that the trajectory of cases was just concerning. But because we're running up to a major election, that wasn't taken seriously. So if you look at the activity in that November, and you see that currently, this November cases have outshot last year, it gives me cause for concern. So vaccination is important, they have to do it, but have we got the legal framework right is the question I keep asking myself, and that would this stand if it's challenged in a court of competent jurisdiction? But when you look at it from the public health standpoint, I think the decision looks right for the protection of the citizenry.
Okay. Doc, I will need you to give us maybe a minute's response to what he just, the central question he just asked.
Yes, if we are doing the right thing, yes, I think he said it rightly. We have to balance human rights as against the Public Health Act. And we are standing on the Public Health Act of Ghana. That's the reason why we made that announcement, because we want to protect lives and livelihood, first and foremost. And we want to make sure that anybody coming into this country is vaccinated and safe and is not bringing the virus here on to come and infect us. We should also I want to quickly bring everybody's mind to the fact that, in fact, the second wave from January, February, and March, we know how it started. It started with the influx of people. It started with people who came in and didn't follow the laid down safety protocols. Most of the people, both at the private sector and also public sector, who went to hospitals. We all know that if you ask the history, most of them who were positive, who were struggling for their lives, all went to either a party, a funeral, a family gathering, and all sorts of things. It is not apparently from what the history that we got from patients, that it was mainly from political activities. That one, we didn't have any concrete evidence to prove that. But what you know was that most of the patients who fell sick were either at parties, at weddings, that's post-wedding celebrations, or at funerals, and not the funerals per se, but after funeral celebrations. That's the reason why we believe that this year we have to do everything possible. Apart from this release which came, that we are trying to make sure that those who are coming in are safe in the first place, and they will be safe.
But the legal question.
We also want to make sure
the legal question is important, Doc. The legal question is important. Over the world, we know the legal question has come up. When you say you are relying on the Public Health Act, I don't know which part of it that says that the vaccination currently ongoing is compulsory.
Yeah, what you are saying, the vaccination currently ongoing, we are not saying that if you like it or not, go for vaccination. What we are saying is that if you are coming into the country, we want to insist and we want to make sure that you are fully vaccinated. I don't think that it should, from public health point of view, we know how people come in and bring the virus into the country with the different strains and variants. And that is what we are preventing. And I think, you are a lawyer, I'm not a lawyer. I don't believe that anything prevents us from making sure that this is done. There are countries where when you go, either you like it or not, they will go and mandatory quarantine you. That one too, I can say it's against my human rights, because I want to go.
We have made law for it in the Imposition of Restrictions Act. On the back of that, the correct EIs have been passed by the president, and I suppose that you help with the wording of it. But Dr. Kome of the East Hospital has been talking about COVID-19 treatments. You know, he's in charge of the East Hospital COVID-19 Treatment Center. He tells us that it takes 28 days from the day of receiving the second dose for the vaccine protection to fully kick in. So questioning, in order for a traveler to be admitted into Ghana, does it matter when they receive their vaccination?
What you put in the release is that you should be fully vaccinated. And there's a meaning of fully vaccinated. That's what Dr. Kobe is telling you.
Right.
So if you plan to travel, you see, those who are coming from outside, they have all the facilities, everything, opportunity at their disposal to have been vaccinated from January this year. So if you know that you want to travel to Ghana, we believe that you should also make sure that you are protecting yourself, and also you get the people that you are coming to visit, your relatives, your loved ones, also to be protected.
The provision in the release about fully vaccinated is simply that if you are taking AstraZeneca, Moderna or Sputnik, you are going to get 2 doses. You must show that you have had the 2 doses. That's all. If you are going to use Johnson & Johnson, it is a 1 dose. So you need that. That doesn't address the question I asked.
Yeah, Samson, we know that we already have 2 layers of protection or to make sure that we receive those who are coming. This is a 3rd one we are adding. 1, before anybody comes in, if you are PCR negative, you will not be allowed to even board a flight. We test you at the airport. So this is an extra precaution that we are taking. So it is even better that even the person had the vaccine about a week or 2 weeks ago, full dose, than not to have it at all. So we are adding a 3rd layer to make sure that we have 3 layers where we make sure that we receive everybody who is coming. As I said initially, we won't get it 100%, but we are limiting importation of any virus into the country. That is the idea.
All right. We are doing very poorly as far as comparatively, if you compare with other countries, the vaccination achievements that we have made as far as the population is concerned. I'll come to that because we want to talk about the generality of the of the populace, what is being done in that regard, particularly in the festive season. Senor Jose, thank you very much for joining us. And they were very instrumental in mobilizing corporate Ghana to be able to put up that center. What's the name again?
Ghana Infectious Disease Center. That's where Comey runs.
Right. The Ghana Infectious Disease Center, which is a very nice place, you know, where people are getting treated, and some of our big men, politicians, have had to be, you know, taken care of. What do you say, particularly about the protocols for travel because of Omicron?
I must admit that, before probably I address the question, Dr. Nsiah was very, very instrumental also in the development of the facility. His service to this country on COVID has been remarkable, and I commend him for his service to the country, Doc. On this particular issue, the statement, I'm just more concerned that we are just focusing on one side of the entire mix and not looking at the holistic challenge that we have. There are clear issues about making it mandatory for people to vaccinate. I mean, I'm sure somebody will go to court one of these days. I'm sure you'll be ready to represent them. But
I have certain principles that I don't change. I live on the law.
Yeah.
But when you throw common sense away, I won't help you.
Very well.
Yeah. I don't need the law to say wear the mask.
Exactly.
I'm thinking about my life.
Exactly. But there are a lot of very negative sentiments around the vaccine, but it's actually driven by poor information and education. I am concerned about how that can be deployed. But on the technical side, having been very close to COVID, I really understand what you're doing. And it is in our interest to ensure we get a lot more people vaccinated. We look at the data coming off from the GIDC, which was really set up for most of the severe cases. Practically all the severe cases were sent there to free up our regular hospitals. We don't have problems with vaccinated people. They come and it's just OPD cases. In a few days they are gone, whether it's Omicron or it's something, another variant. It's not that severe. And I want to believe that the move being taken by government is actually in line with that. But I would encourage them to make sure that they cover themselves right on the legal side, so we don't really bring this whole thing in some kind of terrible stalemate with enforcement. And that's where I have concerns. But you don't have this, like he said, Doc here said, you don't have this when you travel around. When I actually go to the US, I actually go with my PCR certificate. I land there. I just walk in once I can actually show that. But here we have an extra layer. It has proven to be quite effective because we found cases. All right, sometimes some of them have been false positives, but we are better safe than sorry, you know. And I think that structure is prudent. I can only say this is technically sound, legally challenging, and I'll pray that government will deal with that side with it.
Now, there's this aspect that I want us to explore. There are concerns, for example, about protocols for government officials who have been traveling. Some have encountered them at the airport, and they don't seem to be taken through any process. It does look like there's a VVIP protocol. They just come and they're isolated. They move away.
I can confirm that.
Everyone else, you can confirm that?
Yes, I've seen that with my eyes.
How terrible would that be?
Samson, I'll come to that, but I've just been looking at Ghana's Public Health Act 2012, 851, and there's a clause on public vaccinations and compulsory vaccinations, 22.
Okay.
And I'd want to read that. It says, the minister, by executive instrument, generally, or with reference to a particular district, area, or place, or with respect to a particular class or classes of persons, order the person to whom the instrument applies who do not produce satisfactory evidence of successful vaccination to be vaccinated by a public vaccinator.
Great.
Unless, in the opinion of the public vaccinator, the vaccination would be injurious to health.
Okay, so the minister needs to issue the instrument.
That's the point I'm trying to make. That they seem to have put the cart before the horse. And that's why I'm saying that I'm not a lawyer, but I like to look at these things more broadly and bring the clauses.
There should be order.
There should be order. And
you know, when it was declared by the World Health Organization as a pandemic, the health minister had to issue one of such.
Yes.
So that's the process that has to follow. Unfortunately, and to be very blunt with you, our government has been very terrible when it comes to promulgating the basic EIs, as in executive instruments. They promulgate one, they wait, it lapses, and there's such a long time until somebody shouts, why don't you renew it? Then there's a renewal. Then they wait till it elapses. It's very bad. Yes.
Yes, so what I would, therefore, it looks like even under our laws, mandatory vaccination is legal, as long as the legal instruments are put in place.
That's right.
So that then shifts the needle a bit for me in favor of public health law as against human rights and democratic credentials. Because that means if the instrument is issued to prevent more variants, which is my major concern, and to prevent super spreader events, vaccinating at the airport would be a legal point. And then I would look at the individuals and say, your personal liberties and rights should not infringe or risk my life because you don't get vaccinated. You then become infected. Like Senor was saying, you go in, you may pass away or be critically ill or seriously ill. But even if you went through that, the cost of managing you is at my tax expense.
Right.
I shouldn't be
taking... Because it's a public health issue.
Yes, I shouldn't be taking the tab for people who have been bloody-minded and cynical at a time when we need to be each other's keeper.
That's right.
So that is how I look at it from this point of view. And on that, I then come to your question because it links to it in the sense that if we are saying that the government should put the requisite instruments in place so that people can be vaccinated to minimize the risk of bringing infection. And we know that even triply vaccinated people, even though now the data, and that's what I'm looking at, says that you're about 99% unlikely if you've had 3 doses because of the high antibody titers to have symptomatic disease and all that. Now the data is evolving and we're getting clarity. Have to go through all these, and you as Mr. Minister, Mr. Chief Executive, you'll be driven in an SPD vehicle to come into the population, and you are more than likely to be the ones who at Christmas would have parties because you have to fet your constituents and hangers on and all that. And then make nonsense of all the legalese that we are saying that should be put in place at the airport.
And you remember the second wave that we got into this country? Small parties and the rest of them triggered.
Yes.
Now, that brings me to the question I had asked Dr. Nsiah-Sarri. So if I got up today, I wanted to come to Ghana. All I needed to is go get a J&J jab because it's 1 dose. And then I come into the country. I am not protected because I need 21 days at least to receive the protection that the jab gives me. But this guideline we have gives me the room to come and mingle with the people and I'll spread.
You see, Samson, this virus, I keep saying, is taking anyone who works in the biomedical ecosphere on a very serious tutelage.
A very slippery one.
Yes. When it all started, when you got infected, they said, what's the latent period, i.e. the period between which you get infected and it's detectable even by the most sensitive tests like the PCRs and other things was about 3 days. And that is why, if you heard Dr. Nsiah-Sarri, he keeps saying, we'll minimize, because you cannot eliminate it coming into the country. Now, that period has decreased to 48 hours. So the UK has actually changed its legislation that your PCR test should be within 48 hours of your entering the country. So what I see the Ghana Health Service doing is they are saying 3 barriers. We've left it at 72 hours, but if the PCR doesn't pick it, the antigen would most likely pick it at the airport. If all that fails, you are vaccinated. I see your point that but your coverage is not optimal for up to about 3 weeks after getting that vaccine. But I also ask myself, can we have it absolutely watertight? I would have thought, if I was consulted on this, to say that they should have put in a 14-day time lag from your second dose, simply because if you're using the 2-dose vaccines, after 14 days, you're generally, because they say 22 doses after your first jab, 22 days after your first jab, you have optimal antibody levels, and then 14 days after your second to 21 days, you get the optimal peak for the second dose. And now, with the third dose, it's saying 7 days because your immune system knows it and all that. So I'd have said, to balance it and to factor in this Johnson & Johnson, let's put in a 14-day caveat. That said, they've not done it, but still not too late, because they still have to issue an executive instrument. Right. So if they have to do that, they can co-opt that in. And that is why when I have these conversations, I said that we have these conversations because we want to make the situation better.
That's right. That's right. Let's hear Dr. Nsiah-Sarri. If he's taking any notes from the issues that we are raising right now, do 1 minute before we hear him.
Okay. So you see, we are saying that people should come in and right at the airport, if you are not vaccinated, you get vaccinated. The person still has the same 14 days.
Yes.
All right. Now somebody's coming and the person has already vaccinated. What really is that difference?
There is a difference.
The person is already vaccinated. He's still going to actually have a shorter period to have his body fully immune than the person who you're actually jabbing at the airport. So why do you really want to keep the rules different for them?
No, and that was why I referred to the Public Health Act, and I know something you want to go. The difference is that for those who they are saying are going to be vaccinated mandatorily as per the law, they have to be Ghanaian citizens or Ghanaian residents. So they have a legal right to return to their country. The others coming in,
then why don't we quarantine them if we are really that?
We could not, like I said, that's why we are having these conversations.
But I just feel that to just be a bit too much to really want to.
Because the UK has the same thing. Now, you cannot travel from, say, Nigeria and South Africa and all that if you are not, but if you are a UK resident, you can still travel in, even though it's red listed, just that you'll be quarantined for a number of days. So
that's self-quarantine.
Yes.
Okay. So let's hear Dr. Nsiah-Sarri. From what you have heard around the table, what do you say? And the concern that some citizens have raised about politicians when they get to the airports.
They actually go to the CIP lounge for their test.
Okay.
Yes, I think politicians, when they get to the airport, follow the same rules and regulations that ordinary person is supposed to do. At the CIP lounge, there's also testing there. So if anybody passes there, the person is tested. If it's positive, is isolated. If you pass through the main and Terminal 3, you also go through the testing. So I'm not too sure which politicians have been passing through. We hear that some people bulldoze their way through, but when we see it, we take the necessary actions. So everybody, every Ghanaian, every passenger who passes through the airport is supposed to go through, and they go through all the testing. Yes, I was going to quote also the Public Health Act, Section 28 and the rest, that the minister has the right to come out and say that, look, everybody who is coming into the country has to be vaccinated. You are talking about the EI. The EI will be made and it will be published, and everybody will see. That one is done from the president.
Yes, but Doc, the concern is here. For example, the president used to do, his normal encounter with Ghanaians. And then he will spell out certain things that will not be allowed, will be prohibited. And sometimes it will take over a week or two. His word is not law unless it has been put into the EI. And, there was always room left for people to misbehave.
Something, we hear you, take note from it. And the president will be speaking very, very, very soon on these new measures. And the EI will also be made and then published. The next thing I want to say is that, as all the speakers have been saying, I think we are adding this as a third layer. And I will still maintain that it's better for the person who has come in with the other two, which are all negative, to also come with a third layer, which is fully vaccinated. And we are giving a window of 2 weeks to only Ghanaians who, for one reason or the other, have traveled outside the country they have to come home by all means. So we are saying that if you are coming and you are not fully vaccinated, they should allow you to come home. We will vaccinate you. If a Ghanaian is positive, we isolate our citizens the same way that we isolate other people. So all these things together, we believe strongly that, and also with the safety protocols adhered to, which we are also going to make sure that it is done. The president, when he speaks very soon, will also outline all the various safety protocols that we have to follow. We have to have the Christmas. We cannot also say that people should not have their livelihoods, but we have to do it in such a way that we do it within a specific protocols, and all the people who are coming will make sure that, for example, there's going to be an Afotilia, I think on the 28th of December. But we have strict protocols that we have drawn with them that they have to follow at the grounds. And we will admonish everybody that it doesn't give you any good if you go and do things that will not help you. I'll give you a story. During the second wave, there's somebody who went for a party and he lost 3 of the close relatives. They didn't go for the party, but he went to the party. He was positive, but he was strong. He has very good immunity. But the elderly people at home, he lost 3 of them. So that's what we've been saying, that we will add all these things together, plus the safety protocols. And I believe that we may not be at where we were last year. We've learned from the mistakes that were done last year, and we don't want it to happen again. But the EIS will come out, which will back all what you are doing. Ghana Health Service has come out with the release. The release have to be communicated by note verbal to all the airlines. It takes about 72 hours to do that. And by that time, we are hopeful that the EI will also be issued.
Okay.
So that these new measures will work for
Okay.
everyone.
If the president speaks, is he going to tell us about protocols for Christmas? There are mega programs that are being, as it were, advertised ahead of Christmas. And I gave the example. I was shocked, really shocked, when I was watching TV, the finals of the Science and Maths quiz. And I saw, the television cameras as they went into the various schools. I was surprised that people are in boarding school. They are in school and they are not wearing masks. And they are gathered, sitting at one place for hours and shouting and singing. And it's all over the country, really.
Yeah, something is true. The president will speak. He will also mention all the various protocols that we have put in place. We are not changing any protocol. The protocols have helped us, and we will continue abiding by the protocols. We will speak. In some places, the security agencies will also do their job. And for example, for the boarding schools, every headmaster, every senior housemaster, and the masters in the schools have all been taken through the safety protocols. Right. It's unfortunate that maybe what you are talking happened, but we will make sure that we will continuously be communicating to everybody. We use your media to also help us to communicate to everybody that it is not yet over.
So effectively,
immediately the cases go down, that's where people forget themselves.
Right. Effectively, there's going to be vaccine mandates. There's going to be vaccine mandates.
Yes, there will be vaccine mandate. That will also year will back it. That's the reason why we've made December as a vaccination month.
Okay, so that for example, I can't go to church or I can't go to the mosque without proof of vaccination. Is that what's going to happen?
We will come out at the end of the month with what is in the mandate. I think the minister mentioned some few things that we want to do so far as the mandate is concerned. We want every one of us, everybody who has not taken his jab, to go today or the days to come. We are bringing the vaccines to the doorsteps of the people. And everybody should take advantage, because very soon, now it started with people who are traveling in and out of Ghana. Very soon, it will also come to activities like going to church, going to school, and all sorts of things, or going to lectures for the university students. So there will be a mandate after we have given everybody chance to be vaccinated. So definitely in January, the mandates will come out and to be backed by executive instruments.
Yes, yes. What do you say about our attitude as you watch us? You've just come into the country, you watch people, and you've been in and out for a while. What do you see and what do you think we are not doing
I've always said, and when I speak to my colleagues who work in the Ghana Health Service, some of them are very close relations, I tell them that you drive through Ghana and you get a semblance that the only thing left is for the WHO Secretary General to come into Ghana and officially declare COVID over. You don't see anything. Yes, you see it when you go to official functions, like you're at a conference.
But Doc, it's not different from the UK. It's not different from the US.
Yeah, but that's what I'm going to
It's not different from the UK and the US.
Yes, but I'm going to make a comparison. That was where I was coming to. I want to make a very strict comparison.
In any case, we can't afford what they can afford.
No,
so we can start comparing ourselves to them.
So let me finish. I'm making a very serious comparison, and hear me out. I see it. I live in the UK. Cases are going up. I just looked at the latest case dashboard, and 51,000 new cases came yesterday.
Yeah.
They were predominantly in people between the age of 9 and 19 who are in secondary schools or leaving. The truth of the matter is, if you look at the data, currently UK has given 40 million third doses, not second doses. They have given more doses than the whole of West Africa has given for their 2 shots. One. Number 2, if you look at the OECD countries, their total third dose, they've given more doses than the whole African continent has given for 2 doses. Number 3, when you live in the UK like I do, and if I open my bag, you see it, you are encouraged to get the test that you see at Kotka, the lateral flow test, and test yourself twice a week. I've been in this country, and because of the job I do, I have to test myself daily and update the system. So if you see me walking around in the UK, not wearing a mask, I'm triply vaccinated. I'm testing daily, right?
Yep.
I live in an echo chamber because my work colleagues have to do same. If I decide to go for a sporting activity, I've got to show that I'm fully vaccinated.
Yes.
I've got to have a lateral flow test to enter.
Yep.
And 7 days after, I've got to upload another test to say that I haven't picked any infection. How can you compare that level of detail and the fact that they are moving around to what we see in Ghana, where our test numbers are low? Secondly, even now, 2 days ago, face masks have been introduced as law in the UK because of the section of the population in which the pandemic is now situated.
Yeah,
and the fact that we are coming
younger
up to
folks.
we are coming up to Christmas, and they have learned, because these people are going to visit their elderly folks in the nursing and residential homes with their grandparents who are in there. If they go infecting them, we'll have a massive death spike. So they've legislated against it.
Right.
That's all we're asking.
Right.
So you see the disparity between the two.
Yeah, and initially when it happened, I said we shouldn't do that because when it happened, we needed ventilators. We were crying for 1, 2. We couldn't get. And the UK, they were manufacturing in mass, in the thousands, and in the US as well. So it's bad to make that kind of comparison.
No,
really.
no. The key thing here is that to suggest that when you come to Ghana, it's as if there's no more COVID by the WHO. I'm saying that WHO sees that in other countries. So it's not that different. Doesn't mean that we should.
There were Ghanaians who went to watch football matches at the stadium.
Yes.
Unmasked.
Yes.
And were drumming and dancing all over the place. Somebody was asked the question. He said, well, he's watched some match in Europe and nobody had a mask when they were in the stadium.
Is not effective.
No, it's effective.
It's not
Because
effective.
they've all tested.
But people
It's
had
not effective.
tested, people had vaccinated before they went in there.
I mean, that's
All right.
that's legitimate.
Okay.
You know.
Yeah, so what do you say? What should we be doing locally, generally, ahead of Christmas?
Very well. So my key thing here is that I really want to see the GHS and Dr. Nsia Sari on our regular life. Spending too much time on the travelers, I don't think is really our solution right now. We still have COVID in the system. How do we live our lives now, and what protocols will truly be enforced and not just spoken about? You don't go to a restaurant. Look, let me tell you the funny thing about this whole thing. You enter a restaurant, they say wear a mask, and you spend the whole time in the restaurant not wearing a mask. You understand? So we didn't have that situation when we actually had, that was last year during the election period. We were not allowed to really be spending time in restaurants, but restaurants were open in some, but we didn't have it that fully open. Today, we have everything fully opened.
Right.
The only thing we are not seeing are the beaches being really overrun, but you go to the beach, you see people still there. So the question here is, Now that we are practically fully open as an economy, what rules will apply? What rules will truly be enforced? Government has been speaking too much poetry and acting prose. This time around, we really need to see proper action. And that is what I was hoping to hear the JHS on. And I've still not heard it.
Doc says that the president is going to speak, and then following from that, a number of things will be put in place.
And one note, Samson, we've been talking about vaccines. Where are the vaccines? When I was in the US and we were talking about vaccines, it was so easy for any Joe to know where to go. Do you know where to go for your vaccine? I don't know where to go for vaccines.
Oh, why?
I'm being honest with you, but I mean, I'm vaccinated. I'm quadruple vaccinated.
Okay.
You know, but the issue...
Maybe you have not followed, because back here in Ghana, we knew how the process was. So we know the places where people are supposed to go and get their vaccination.
I'm a privilege.
Once you get your first dose and you need a second dose, you know where to go.
I went to Ridge. Dr. Nsias arranged that for me. All right, I went to Ridge and I got my AstraZeneca here. Talk to the average Joe. They don't know where to go for their vaccines. Okay. By now, what I would have expected for us to start taking major centers, keep people there from morning to evening. Take a place like Elwak. Let's load the place with personnel. Everybody knows you just have to walk in. In the US, it was simple. Every CVS, every Walgreens, you know you can just walk in there. You don't need to even know which hospital. Today we are here, tomorrow we are there. That's what has been happening here. It's not open full time. So we need to have something running every day till the end of January or something of that sort.
Okay.
And have
Thank
major
you. Let me go and wrap up with Dr. Nsias so that he'll address a few questions that he has said from you guys. But Dr. Kwame Asiedu Sapong, now there are guys who want to know, in those countries where they started using AstraZeneca, we know later they practically abandoned it, they began to give boosters. Is Ghana doing a similar thing? There are people who also took the AstraZeneca like myself, but the interval between the first and second dose later became a political rationalization. The medical explanation eventually vanished. And it was as if even if it takes me 6 months, I could still go for the second dose and I'll be fine. People have a feeling, should I go for Johnson & Johnson now, even though I did AstraZeneca and the interval was so long and all of that? Should there be boosters? Can somebody who has already vaccinated with AstraZeneca attempt to take another, vaccination?
The simple answer is, one thing is becoming apparent, that whether you have 1, 2, 3, 10 doses, the immunity wanes over a period. Now it's being positioned at about 6 months. That we knew, because I remember coming on this show and talking about, we were discussing reinfection, potential reinfection with COVID.
Right.
And I said that the immunity lasted for wild exposure between 3 and 8 months, because at that time the data was there. Now it's known that it wanes after about 6 months. That was also known. And that was how the Ghana Health Service explained away, when we couldn't get vaccines, the 1 dose, because the antibody titers were detectable up to about 40 weeks. So I was in that school of thought who said that we would rather a lot of people have 1 dose because we didn't have vaccines than have few people having 2 doses, only for them to get reinfected at the end of the day. Now there are vaccines available. We need to roll them out as quickly as possible. The emphasis should not be really on the waning of immunity. If you see how Omicron emerged, it should rather be on the widespread coverage of the population. The higher your vaccinated population, the lower your likelihood of disease, of hospitalization, and of mortality. And you've said, yes, and you've said you can see it in Ghana, even at the Infectious Disease Center, where over 80% of the people who are coming are unvaccinated.
No issues.
It is a global phenomenon. The third thing I'd want to conclude on is the fact that bad news travels, good news doesn't. So what a lot of anti-vaxxers are doing is, let them see one person who's been triply vaccinated who unfortunately passed away from COVID. They would hang that on a red rod and fly it as their national flag for the whole world to realize that the vaccines are not working. But when you go into the data in granular fashion, you realize that All they are doing is just whistling. There's nothing there. And so that answers that question that they should go for the vaccines. I encourage everyone to go for it.
If you have taken one already?
Even Johnson & Johnson, it would wane after 7 months, we know.
Okay.
So you take, like Senor said, in some countries they've had. Then the final bit of your question is the mix and match. Initially, the answer was no. Now it's actually being encouraged.
Yeah.
If in the UK, for example, people have had the first dose of
AstraZeneca.
Pfizer, second dose Pfizer, third dose Moderna. First dose AstraZeneca, second dose AstraZeneca, third dose Pfizer. Because it is being found that they jolt the immune response slightly differently and give you better immune coverage.
Yes.
So all these things are evolving science. And for me, that's what matters.
Okay.
And that's what we have to look at.
Interesting. Yes, Dr. Nsiasare, what do you say? Because these are concerns that some Ghanaians have, that they feel because of the attack that AstraZeneca received, either they need a booster or they need, revaccination, so to speak.
Yeah, what I would say is that you don't need revaccination. We will continue giving as Dr. Osiedu said, as the immunity wanes after about 6 months. And I don't think anybody took the AstraZeneca and stayed for more than 6 months. So if you have gone for your second dose, it's good. What you want to do now is that we want to make sure that everybody who is supposed to be vaccinated has at least the first and the second dose. The mix and match, we are studying it and we'll come out with a policy. For the booster, we want as much as possible a large population in this country to have at least their full vaccination, and then we also will see there are some vulnerable people.
You don't want to encourage it. You don't want to encourage. You don't want to encourage the mix and match or people going for whatever because you don't have vaccines.
We have vaccines. As we speak now, since we started having vaccines in the country, so far we have about 17 million doses of vaccine in the country. And by the end of the year, we are expecting another nearly about 10 million doses. We are getting vaccines, I'm sure, if you check almost every day or every other day.
So I should feel free to go in again when I have done 6 months.
Not if you have taken your 2 doses.
Okay.
But anybody who has gone for the first dose, if it is AstraZeneca, after 6 weeks, 8 weeks, you should go for your second dose. If you have Pfizer, within 3 to